there. So my name is Tom Dilworth. I'm the Director of Clinical Pharmacy Services for Advocate Health Midwest. I got a Bachelor of Arts in Spanish Language and Culture at the University of Wisconsin-Milwaukee, and then I went and did my PharmD at the University of Wisconsin-Madison and followed that up by a PGY1, PGY2 Infectious Disease, and an Infectious Disease Research Fellowship at the University of New Mexico. In terms of what inspired me to choose pharmacy as a career, I really didn't start out in healthcare at all. I started out as a philosophy major and I pivoted to Spanish. And then I thought healthcare looked appealing. My mom was a nurse. I decided on pharmacy because I took a job as a retail pharmacy technician. I looked at what pharmacists could do for patients and their families. They seemed content in the job that they were doing and they seemed respected. I also didn't want to be hands-on with patients like a nurse or a doctor, something at that time that just didn't sit well with me. In terms of a typical day, I've been in my current role for 2 years. Previous to that, I was an infectious disease pharmacist and PGY2 ID program director for a number of years at one of our larger hospital sites in Wisconsin. But then in my current role for 2 years, I oversee our drug policy team, which is 4 pharmacists who support the Advocate Health Midwest Pharmacy and Therapeutics Committee, as well as order set reviews and other things as well. And I also support the ID pharmacy team, which is 10 pharmacists in total. I work from home primarily, but I travel amongst the hospital sites in the Midwest market, Wisconsin and Illinois, fairly often. And more recently, I visited sites in the Southeast market of our health system, including sites in North Carolina, Georgia, and Alabama. I also oversee pharmacy practice advancement in the Midwest, but this is largely executed through our pharmacy shared governance structure, but I help to guide it as I can. A typical day for me is hard to describe. My days can be dynamic, and because I'm positioned as a clinical lead for our Midwest market, I often get pulled into meetings and conversations, sometimes without notice, and this leads to some of my days being more dynamic than others in terms of scheduling. But in general, my days are comprised of strategic pharmacy meetings, one-on-ones with my team, collaborative meetings with medical staff leaders, as well as meetings with pharmacy leaders, pharmacists, pharmacy shared governance leaders, as well as nursing leaders. And as much time as I can protect for deeper strategic thought, I do so. I also precept PGY2 residents in our PGY2 HSPAL program. In terms of the favorite part of my job, I would say the best part of my job is building relationships. And the second best part is empowering others to do their best work and to grow personally and professionally. I want our pharmacists and our profession to be a key contributor to patient care for years to come. And that really can't be done without building strong relationships inside and outside of the profession and empowering people to do their best work. At the end of the day, I want all of our pharmacists and technicians to be impactful now and be impactful in the future, and setting up structures and relationships to allow that to happen, again, is the best part of my job. In terms of advice for someone who's interested in a career in pharmacy, I would say keep an open mind. Pharmacy is a very unique profession because once you have your degree, you can do just about anything. You can work in a clinic, you can work in a retail pharmacy, you can work in an intensive care unit, you can work in a compounding pharmacy, you can be a drug policy pharmacist, you can be a medication safety leader, you can be a pharmacy leader, you can work in pediatrics. It's actually quite remarkable as far as healthcare disciplines go. So don't let anyone tell you that you have to do something a certain way in your career. There is no one way. And healthcare is changing rapidly. So having an adaptable career path and a skill set is a really good thing.